stigmatized for anything of what you're wearing, your religion, your race, your color, anything is stigmatized. And I just think that's why we're all here, to erase that from Wikipedia. Brandon Chambers. All right, everyone. You're going to have representatives waiting over there at the rally. They're going to speak to us about their commitment to so, everyone could go.
Sit here and eat before I go over there.
Hello, everybody. I got to tell you, this has been a fantastic day. I am Jamie Farish with the Oregon Family Support Network, which is a family organization, and I'm also now home to the statewide Youth Move chapter, which is motivating others through voices of experience with the youth. And really excited to be here today, and I know it's especially exciting for a few of us that really had this vision even 2 years ago around just gathering youth at the Capitol in shirts and making a statement about children's mental health and mental health in general. So thank you all for being here. So I'd like to go ahead and quickly thank Wraparound Oregon for all the work that they've done and for the shirts that we're wearing. Without them, we wouldn't have our shirts. So let's give a round of applause. And a big thank you to our Youth Move leadership as well, who have really handled a lot of the details today and planned everything from the talent show to emceeing and all that stuff. So a big round of applause for our youth. Okay, we're going to have a few speakers, and I have the privilege of introducing Claudia Black, and she's the health advisor to the governor. And so that would be the part that Martin was referring to as the governor's here, sort of. But in reality, those of us that have been to the legislature, and for all of you that are learning about that recently, Claudia actually is a key person that listens to all of the issues and what we have to say, and then she takes that back to the governor. So really she is an excellent outlet for you to talk with and let her know where we're at and what matters to you, like, for example, the wraparound bill, 2144. We have another hearing coming up, and we're really going to need families and youth to be there in support of wraparound and why we need it, and particularly why we need this legislation to say it's okay for partners to come together for kids and to do what's right for kids. And in fact, we do need the legislation. Without it, we would have done it already. And so there is no better time than the worst economy in many, many years. There's no better time when all the funding is getting cut and people don't have enough to eat. There is no better time to come together and blend funding to help kids be successful at home, in school, out of trouble, and with friends. So I just want to send that message that we're in support of wraparound, and welcome Claudia up to the front here. Thanks.
Really appreciate everybody turning out. I've worked in the Capitol since 1991 off and on, and what I see really makes a difference is people coming to the Capitol and sharing their stories and advocating for themselves. And actually, I want to recognize a young man right here in front that has been part of the discussion. Hello there. Good to see you again, part of the children's wraparound discussion. Really impressed by the depth of your commitment to working on this issue. And one thing that we really need to do is to increase the youth and their families' activities and involvement, both in treatment. You all are the ones that have the answers to the questions we've been asking for a long time, and so we're just delighted to have you here. And I'd also like to recognize those folks that the providers in the mental health community, because without you we wouldn't have a system of support. I have the honor today of reading the proclamation that the governor has signed, and this, I'm going to read it to you, but basically he designated yesterday, but we're celebrating it today, as Children's Mental Health Awareness Day in Oregon, so all over Oregon. So I'm going to read it now. Whereas addressing the complex mental health needs of children, youth, and families today using a public health focus and incorporating health promotion, prevention, early identification, and intervention and treatment is fundamental to the future of Oregon. And whereas the need for comprehensive, coordinated mental health services across all service agencies for children, youth, and families places upon our communities a critical responsibility that is being addressed by the statewide wraparound initiative. And whereas the efforts of Oregon's children's mental health providers, administrators, and caregivers are deserving of commendation for their unrelenting service and striving to care for the mental health needs of children, youth, and families in all Oregon communities. And whereas it is appropriate that a day should be set apart each year for the direction of our thoughts towards children's mental health and well-being. Now, therefore, I, Theodore R. Kulongoski, Governor for the state of Oregon, hereby proclaim May 7th, 2009 to be Children's Mental Health Awareness Day in Oregon and encourage all Oregonians to join in this observance. And I just want to tell you one more thing. You know, we've been working really hard. The legislature has been all session on healthy kids, providing health coverage for all kids in Oregon. And I believe that we're going to come out of this session with a bill that will provide access to health care for all kids. So I think that's something we can also feel very good about. Again, thank you all for being here. I'm going to hang around for a little bit, so if somebody needs to talk to me, I'd be happy to meet with them.